Hello, and welcome to Lowermark Student Insurance. We're excited to have you with us today. My name is Anu. Healthcare in the United States can be very expensive and may work differently than it does in your home country. For example, if you broke your leg at home, you might expect to pay $100, $50, or even nothing for care. In the United States, emergency room treatment for a broken leg can average up to $6,000 to $10,000, and if a surgery is needed, the cost can average $30,000 to $50,000. We'll give you another example. One student needed an appendectomy after developing appendicitis. The surgery went well, and the student recovered quickly. But a few weeks later, they received a $15,000 bill in the mail because the hospital had not received their Lowermark insurance information. The student contacted us, and we worked with the hospital to have the bill sent to us, Lowermark, for processing. After insurance was applied, the student paid only a small fraction of the original amount. This is why it's so important to understand the essentials of how insurance works in the United States and to carry your insurance card with you all the time. In this video, we are going to walk you through some of the most important aspects to your insurance with Lowermark, including how to get your ID card, where to find details about your insurance plan, finding care, and many more. We'll begin by getting familiar with Lowermark website, and I will hand it over to my friend Gabe now, who will show you how to navigate the site and find resources available to help you use your plan with confidence.
Thanks, Anu. The Lowermark website, lowermark.com, is your main resource for information about your international student health insurance. You can review your plan summary, find helpful resources, and contact our team if you need assistance. Here on the homepage, there are a few ways to access your student account. You can click the student login button at the top of the page, hover over For Students in the navigation bar, and click Log into my account, or click the Get My ID card button here. If you're new to Lowermark and haven't set up your account yet, this is where you'll create your login. To get started, you'll need your date of birth and your student ID number. Keep in mind that dates in the United States are formatted as month first, day, year, which may be different from what you're used to. Next, enter your school's student ID number. Once you're logged into your account, hover over Start Here and click Online ID Card. Here, you'll be able to view your ID card. We encourage you to always carry a copy of your ID card, whether it's a screenshot on your phone, saved to Google Wallet or Apple Wallet, or a physical copy in your purse or wallet. You'll also be able to view any claims information you have on file and any enrollment details. If you run into any issues or have any questions along the way, we're here to help. You can contact our student advocacy team by calling 1-800-821-7710, emailing lowermarksupport@lure.com, or using our chat feature. You will find the chat feature here on the corner of every page on our website. This will connect you with a member of our team that you can chat with in real time, Monday through Friday, 7 a.m. to 7 p.m. Central Standard Time. Your school has its own individual landing page where you can find your specific plan details. To start, type in your school's name here. It will take you to the page showing your school's logo, letting you know you're in the right place. Here, you will find your school's plan summary, full plan details, and quick links to getting your ID card and finding a doctor near you. You can also see our student advocacy team's contact information here. They are happy to help answer any of your questions. You will also see some important resources and their links, and the previous year's plan summary and full details below. I'll pass it back to Anu to discuss the plan summary and review a few key terms you'll hear when using your insurance.
The plan summary is a great place to start if you have any basic questions about your insurance or how your medical bills are processed. It's a simple one-page document that breaks down your coverage amounts, deductibles, copays, and other important details. Now you might be wondering, what is deductible or copay? Don't worry, I'm here to help. A deductible is the amount you must pay out of pocket before your insurance kicks in. Once you've paid this amount toward your medical bills, you've met your deductible. When you have met your deductible, insurance will help cover costs for the rest of the policy year. You'll also see the term copay. A copay is a small amount of money that you're going to be paying each time you see a doctor. Think of it like a ticket. You pay a set amount when you receive care. Next, let's talk about the different types of care locations listed, such as office visits, hospital visits, and emergency room visits. Here's a quick guide to help you choose. For minor illnesses or injuries like allergies, rashes, stomach aches, sore throats, or pink eye, visit a walk-in clinic. Lower Mark partners with CVS MinuteClinic, where you can be seen for covered services at no additional cost to you. This is a great option for minor illnesses and injuries, since you won't need to pay a copay. If you need care quickly, and it's not life-threatening, such as colds, fever, flu, minor cuts, or sunburn, go to urgent care. For serious or life-threatening situations, like loss of consciousness, broken bones, chest pains, or deep cuts requiring stitches, go to the emergency room or hospital. Choosing the right type of care can also help you save money. For example, an office visit may have a $20 copay, while an emergency room or hospital visit could be $100. In general, use office visits and CVS MinuteClinics for common ailments and save the hospital and emergency room for true emergencies. You'll also see the terms in-network and out-of-network. A network is a group of doctors and providers who accept your insurance. Lower Mark uses a network called Aetna, which includes thousands of doctors across the United States. When you choose an Aetna provider, which is considered to be in-network, you'll typically pay less for that claim. You can go somewhere that is not within the Aetna network. We consider that doctor out of network, but just remember that if you do go there, you may end up paying a little bit more. The Lower Mark plan also includes a wellness benefit, which is not subject to copays or deductibles. This benefit covers preventative care services like annual physicals, immunizations, vaccinations, and well-woman exams at 100% up to your plan's maximum. You also have coverage for prescription drugs under your Lower Mark plan, and is broken out as inpatient and outpatient. Inpatient prescriptions are medications given while you are staying overnight in the hospital. Outpatient prescriptions are medications you pick up at a pharmacy to take home. Prescription costs are covered at a certain percentage up to a specific dollar amount for each policy year. Be sure to review your school's plan details for exact coverage. Now you've seen the plan summary, which gives you a helpful overview of your plan, but what if you want more detailed information, including what is covered and not covered? You can review the full plan details on your school page here. And remember, if you have any question, our team is always here to help. Now that you understand some key terms and have reviewed your plan summary, you're ready to find a doctor. Before we get started, we always recommend confirming your insurance with the doctor before your appointment and making sure you bring your ID card with you everywhere you go. If you're scheduling an appointment or even walking in and they ask what insurance you have, simply say, "My network is Aetna." Now I'll pass it over to Gabe to show you how to find a doctor on our website.
Thanks, Anu. To search for a doctor near you, start by clicking the Find a Doctor button. Then scroll down and click to Find an Aetna provider. This will take you to Aetna's directory of healthcare professionals. Now enter your zip code or current location to begin your search. Next, you will be asked to select your plan, passport to primary network or passport to secondary network. You'll have access to providers in both networks. We recommend starting with the primary network. If you want to see additional options, you can always come back and click on secondary network. Once you've selected primary, click Continue. If you're looking for routine care, you can search for primary care physician. To do this, select medical doctors and specialists. Then choose Doctors Primary Care. And then all primary care providers. A list of doctors in your area will appear. From here, you can filter your results by clicking Filter and Sort. This might look like finding a doctor of a specific gender or a provider who speaks your preferred language. The goal is to find a doctor you feel comfortable with and confident in seeing. If you have any questions, our team is always here to help. You can call, email, or chat with us. Now that you know how to find a doctor and use your insurance, let's talk about what happens after your visit and how to review your claims information online. Once again, you'll want to log into your student portal. You can use the methods we discussed, like clicking here, or under the navigation bar here, or for step-by-step instructions, you can go to For Students in the navigation bar, and under Claims, click Claim Status. After logging in, hover over Start Here and select Claims List. This will show you a list of all claims currently on file for your insurance plan. When reviewing your claims, pay attention to the Patient Responsibility section. This shows you any amount you may owe, such as copays, deductibles, coinsurance, or other non-covered charges. Keep in mind that you won't always owe money. Some claims may still be under review or waiting for payment, so be sure to review the details carefully before making any payments. If you'd like more information about a claim, simply click on the claim number. From there, you can view additional details and download an explanation of benefits, or EOB. This document is not a bill, but explains what services were billed, how much your insurance paid, and any amount you may still owe. If a claim hasn't been covered yet, the EOB will usually explain why. Sometimes the insurance company needs additional information before it can finish processing the claim. When this happens, you'll need to complete a claims questionnaire form. When the form is requested, you'll receive an email from us with instructions. You can also find the form on our website by hovering on For Students. Under Claims, click Submit a Form, and you'll find the claims questionnaire form. Once it's filled out and electronically signed, it will automatically send it back to us. If you prefer filling it out on paper, you can scan and email it to us as well. The sooner you provide the requested information, the sooner we can help move your claim through the review process. If we go back to your school's landing page and scroll down to important resources, you'll find some useful links that we'll go over now. Anu will start us off with Teladoc.
Thanks, Gabe. Imagine you're not feeling well. Maybe you have a fever, a sore throat, or a persistent cough, but the last thing you want to do is leave your dorm or apartment. With Teladoc, you can connect with a doctor 24 hours a day, 7 days a week from wherever you are at no additional cost to you. Teladoc providers can help treat a wide range of common illnesses, including sinus infections, bronchitis, allergies, rashes, UTIs, and ear infections. If needed, they can also prescribe medications that can be picked up at a local pharmacy or delivered to your home. Keep in mind that while the Teladoc visit itself is covered at no additional cost, any prescribed medication will be subject to the terms of your Luremark plan. Teladoc is also a great option if you're not sure what's wrong. The provider can evaluate your symptoms and help determine the next steps. If you need in-person treatment, they can refer you to the appropriate level of care, such as doctor's office, urgent care center, or emergency room. We highly recommend downloading the Teladoc app as soon as possible. It's much easier to set it up now than when you're sick and need care right away. With the Teladoc app, you have access to virtual mental health services at no additional cost. Whether you're feeling overwhelmed by school, stressed about exams, struggling with anxiety or depression, or feeling homesick, you can connect with a licensed mental health professional to talk about your experiences and help you through them. Through Teladoc, you can schedule appointments with a therapist, psychologist, or psychiatrist and get the support you need when you need it.
Scholastic Emergency Services, or SES, is a benefit we hope you never need, but it's one of the most important resources available to you. SES provides support during serious emergencies, including medical evacuation, repatriation, and emergency travel assistance. For example, if you're hospitalized for an extended period, need to return home for a serious medical reason, or experience the loss of an immediate family member, such as a parent or a sibling back home, SES can help coordinate travel arrangements and arrange a medical escort if necessary. In the unfortunate event of a student's death while in the United States, SES will work directly with the family to arrange for the respectful return of their remains. The most important thing to remember is that SES does not reimburse expenses. If one of these situations occurs, SES must be contacted right away so they can coordinate travel and other arrangements directly. If flights or other travel information are booked before contacting SES, those costs will not be reimbursed. We strongly encourage you to save the SES phone numbers and share them with a trusted friend, roommate, or family member back home. Should you ever experience any of these situations, you or a member of your family are more than welcome to call us here at Luremark, and we will help walk you through any of these steps.
Another great resource for mental health support is Togetherall. Togetherall is an anonymous online community where you can connect with other students and individuals who may be going through similar experiences. Whether you're feeling stressed, overwhelmed, homesick, or simply looking for support, Togetherall provides a safe space to share what's on your mind. The platform is like Reddit or any online discussion forum. You can post anonymously, respond to others, explore topics that interest you, read helpful articles, and even use built-in tools like journaling to support your mental well-being. One of the things that makes Togetherall unique is that the community is monitored by trained mental health professionals. This helps create a safe and supportive environment, and if needed, you can also connect privately with a professional for additional support.
In the United States, dental and vision insurance is separate from medical insurance. Your Luremark plan is a medical insurance plan which does not include coverage for dental and vision procedures. Should you wish to receive dental and vision care while you are in the United States, whether for treatment or routine visits, you can purchase a plan separately through our sister company, Lure Global. Another great option for receiving dental and vision care is by purchasing the Carrington Dental and Vision Discount Plan. This plan is different from standard insurance by providing very affordable coverage and offering discounts from 20 to 60% off certain dental and vision procedures. Please note that this offer is not available to individuals in the state of Washington. If you live in Washington, please contact our team for additional discount plan options. We take your private information very seriously. Luremark will not share any of your personal health information with anyone other than yourself unless you've given us expressed or written permission. If you would like another individual, such as a friend, roommate, or school advisor, to help you with understanding your benefits, claims, or a bill you've received, please fill out the HIPAA authorization form, listing the specific individual as an authorized person. This will allow our team at Luremark to speak with them about your information on your behalf. You can find this when hovering over For Students. Under Claims, click Submit a Form, and you'll see this card. Once it's filled out and electronically signed, it will automatically be sent back to us. If you prefer filling it out on paper, you can print it out and email it to us as well.
Before we wrap up, we have an exciting opportunity to share with you. Every fall and spring semester, Lower Mark offers a scholarship to international students, and we encourage you to apply. This is a fun way for us at Lower Mark to get to know you. There is a new prompt each semester. Prompts typically encourage you to highlight your home country, culture, or what you're studying in school. We accept all types of mediums, so whether you want to write an essay, make a video, write a song, or send a painting, you can get as creative as you want with your submission. You can find more information about our scholarships, like when our next scholarship is released, by clicking Scholarships on the navigation bar. You can also see past winners to get some inspiration. We've covered a lot together. Everything from getting your ID card, finding a doctor, understanding how your insurance works, and the many resources available to you. Thank you for being with us. While the health insurance in the United States can feel overwhelming at first, you're not expected to figure it out on your own. Whenever you need help, the Lower Mark team is here to answer questions, explain your benefits, and help you get the care you need. We're excited to be part of your journey and wish you all the best for your future studies. Welcome to the Lower Mark family.